Hi, my name is Cassie and I'm going to show you how to do an NG tube placement on a patient. So before I get started, I'm going to come into the patient's room, perform hand hygiene, and introduce myself to the patient. I also want to verify that they do have an order for an NG tube placement, which in this case our patient does. So I'm going to verify name and date of birth, or the patient can verbalize name and date of birth. So Mr. Templeton, we're going to do an NG tube placement today. And the reason that we're doing that is because you have a bowel obstruction and this is going to help your GI tract. Do you have any questions before we get started?
Yes.
Okay, no questions. Also, are you good with us doing that NG tube placement right now? So I'm getting consent from the patient. Yes, you are. Okay, so I'm going to put the patient in high fallers first, and then I'm going to do some assessments before I get started with the NG tube placement. So hand hygiene, put some gloves on. Mr. Templeton, when was the last time you had a bowel movement? Okay. And then I'm also going to listen to your abdomen too for bowel tones. And then I'm also going to look at your nose. Get the gloves on. Okay, so I would listen over 4 quadrants, and then I'm also going to check his nares to make sure there's no obstructions. And then I'm also going to have the patient include one nostril and then breathe out of the other, and vice versa, to see which one's the best for placement. So in this case, we'll go with this nostril. Okay. Okay. So now it's time for the actual procedure. So I have my equipment here. I have our tubing. I have lubrication. I also have an emesis basin, which I'm just going to put the gastric contents in and test with my pH paper. I have a cup of water for the patient, and that can help with swallowing once I start the placement. I also have a syringe, and that's how I'm going to check the placement, and then also marking tape to mark the tube and also secure it to the nose. So I'm going to put this down in front of the patient first, just in case anything does come up. Some hand hygiene. Okay, put on a fresh pair of gloves. All right, Mr. Templeton, so what's going to happen is I'm going to put a tube through your nose, and you might start to gag a little bit, and when that happens, I'll give you a minute, and then I'm going to have you drink some water and sit forward, and then I'm going to advance the tube forward, okay? So I'll give you your water. There's that. Okay. Open my tubing.
I have everything.
Lube. Okay. So now I need to measure the tubing to make sure that I have right placement. Oops.
Do you want to get 3 pieces of tape ready? Do we need to verbalize?
And I also need a piece of tape for securing.
We each equipment piece, or just say here's my equipment? I really don't know. I don't know.
So to measure, you're going to take the tip and measure to the nose to the ear.
Okay. I don't know. Should I get the root?
And then to the xiphoid process of the sternum. So once I have that marked,
It just says gathers all equipment.
there's the marking.
Oh, I'm just gonna say that I gathered my equipment at a time,
Okay.
the same time for the video.
And then I'm going to lubricate
Do you want to get 3 pieces of
the
tape?
end
Should I do
very
that
well.
during the video? Well, no, you said you wanted to do that before, remember?
I'm going to have the patient tilt their head back, and then I'm going to advance it forward. When the patient starts to gag, give them a minute, pull back a little bit, let them recover, and then have them tilt their head forward, and go ahead and drink, swallow, swallow, swallow.
Final.
Swallow, swallow, swallow. And if it gets hung up, you want to make sure too that it's not getting caught, coiled up in the mouth. You're going to keep advancing forward until you reach the marking.
Knock, knock.
And then I'm going to just secure this in place just temporarily until I verify placement. do that, I'll take my syringe.
Okay, that matches here on my chart.
I'm going to
So,
touch the
Mr.
tubing, and then I'm going to
Bronson,
aspirate.
Order today to put an
And
empty
ideally,
tube
to verify
in
that
for
it's
you
placed in the
today.
stomach,
Some
you're
of the
going to see
orders
stomach
here.
contents come back
Looks
into
like
the
you have a
syringe.
small bowel obstruction, and you're experiencing some symptoms with that.
So then I would
try to alleviate some of
put
those
that into
symptoms
the
for you.
emesis basin, and then I would test with my
I
pH paper to
previously
make sure
added
that we
all
do
my
have
equipment,
stomach contents.
For the sake of time.
So that I verified placement
And then
of the
gonna
tubing.
provide privacy with that
I'm going to
curtain,
fix the
lovely
tape
curtain.
just to make sure that it's
And
nice
then,
and secure. And then I'm also going to
started.
remove my marking tape.
I'm going to raise the bed to a working height.
Okay, and then I'm going to attach
Okay. And
tubing
then I'm going to perform
to
some
suction.
assessments on the patient.
And turn the suction on, make sure it's working
So,
properly.
Mr.
And then
Bronson,
just take the towel, clean
are
up
you
the patient.
experiencing any severe
Sure there's
allergies
nothing
currently
there.
during this season? No? Okay. And
And
have you ever
then
been diagnosed with
just
esophageal
grab a safety pin,
No?
and I secure
Well,
the
just in
tubing
case, we're gonna
to the
let
patient's
me take a
clothing,
quick peek
just so it doesn't
in
get pulled
to
out.
inspect your nostrils and your oral cavity. And we're also
Then
gonna
I'm just
test.
gonna clean up,
for
take my gloves
patency.
off, perform
So I'm gonna
hand
ask the
hygiene,
patient to
and come
occlude
back
one
and check on the
nostril
patient just to
and
make
breathe
sure
out,
everything's going well.
occlude another
Thank
nostril
you.
and breathe out.